How safe would you feel on a plane right now if someone sitting near you wasn't wearing a mask? Today, Transport Canada revealed dozens of travelers have refused to wear masks on Canadian Airlines. The data shows that as of December the 8th, 9 passengers were fined for not wearing masks. Fines can range up to $5,000. 63 warning letters were also issued. Masks are among the measures to protect passengers and crews. Flights are still coming and going despite the pandemic. But how safe are they? Mike Drolet looks into the studies that still show uncertainty.
The trickle of passengers traveling through Canadian airports is less festive than in past years. Not everyone is willing to get on a plane in a pandemic.
Are you joking?
In frigid Quebec City, the lure of sunny Mexico proved too enticing to pass up.
Selon moi, si on prend les mesures.
If we take precautions, says this traveler, the government says there's little danger. But that's not entirely true. The science on air travel safety during a pandemic is full of contradictions. One study showed 15 passengers sitting in a cluster were infected by one symptomatic passenger. Yet a more recent study concluded you would have to sit next to an infected person for 54 hours to catch COVID-19.
Confusing? Well, that first study was done before masks were commonplace, and the second one was done using mannequins who were wearing medical-grade masks. And those mannequins obviously weren't eating, drinking, or moving around like humans. For epidemiologists, gauging the risk comes down to wearing masks, distancing, and being around crowds of anonymous people.
And there have been cases on Canadian Airlines, over 2,000 in fact recorded since March by the Public Health Agency of Canada. A closer look at the numbers shows a steady increase since the summer, followed by a spike in November. And that means, however unintentional, COVID is traveling from city to city.
It doesn't swim or walk or fly on its own. So when you're trying to control a global pandemic and you're allowing a lot of travel back and forth, you're creating a very dangerous situation.
And with an increase in flights around Christmas, epidemiologists fear COVID-19 will land in otherwise untouched areas, which could lead to more outbreaks and ultimately overwhelm an already maxed out healthcare system.
Studies out of Ireland had shown a few people flying in that were pre-symptomatic, and before they knew it, they had 18 individual outbreaks in Ireland following one flight. So it is known to happen.
Will it happen in Canada following this Christmas travel season? We'll know in January. Mike Drolet, Global News, Toronto.